he's also one of our investors. So, um, so we're very excited about getting outside the United States. I think we have our first international investment actually in Barcelona with your coach, started by Marina and Eugene Brockovich. So we're doesn't disqualify you guys from being in our portfolio. And we're glad to have you. Anyway, so John, you could talk about smart care, and Heather, whenever you're ready.
Ready.
Yeah,
Okay, go for it, John.
thank you. So hi everyone, my name is Jonathan Bout and I'm one of the co-founders of the company Gabi SmartCare. Um, the first thing that you need to know is that I have a daughter and 7 days after birth, she's been hospitalized for respiratory troubles. Luckily, she was out after two weeks. But basically, that experience just was extremely terrific. I mean, terrific in the bad sense, right? So it was traumatic for us. And when we came back home, we were very um, um, actually very stressed by the situation. We were supposed to look after some symptoms, but we were just incapable of doing so, just because we didn't have any background or any tools to do that. And actually, we even ended up back to the ER twice. Through that experience, we just realized that we were not the only ones. Like 38% of the kids in the US, for example, are visiting ER or admitted to the hospital every year. And yet 50%, at least 50% of these events are actually avoidable, according to medical literature. That's one thing. But besides that, what's the most surprising is that when you look at all the innovation that is done on the adult side, you just realize that there is almost nothing on the pediatric side. Why this is clearly the period of your life where you're building yourself for the rest of your life. So this is when you're building things that are going to protect yourself for the rest of your life. And if you don't tackle these issues at the right time, then obviously that can easily turn into lifelong health issues. One of the reasons why this is happening, it's basically because all these health situations are just self-reported data, like parents are struggling to report conditions objectively. Some of the most common tests are not applicable on very young children. And all of these lack of objective data is clearly leading up to 40% of assessment errors and very long time of diagnosis period, like up to 3 years for some chronic respiratory conditions. So at Gabi SmartCare, we decided to bring all these objective data to all stakeholders by developing a hardware-enabled smart digital health platform that is dedicated to pediatrics, in order to better prevent, diagnose, and surveil pediatric conditions. The fully integrated solution that we have built has been built around the cloud platform that is connecting the patients and also the healthcare professional. That cloud platform is HIPAA and GDPR compliant, and it's actually fed by a proprietary wearable medical monitoring solution, like the band, that is monitoring the main vital signs of the child. You also have an interface that is alerting the parent as soon as there is a life-threatening event, and it's also collecting some additional unstructured data to the cloud platform. And all these data are then processed with proprietary algorithms that are actually interpreting medically all these data to really deliver insightful information to the healthcare professional to make sure that he can better assess the situation, quicker assess the situation through this health assessment report. This is actually a problem that is affecting everyone. Like, you have more than 600 million children under 5 years old worldwide, and 250 million of them are visiting hospital or ER every year, out of which you have 150 million that are linked to respiratory disorders. And that's one of the reasons why Gabi SmartCare decided to focus their medical interpretation algorithms on respiratory issues. As you know, the adult market is already a proven market. You have a lot of solutions out there that is delivering a huge added value in the medical care for adults every day. The problem is that you don't have anything for pediatric yet, and actually the challenges are very different. If you put an adult solution on a pediatric, on a young child today, it's going to return some false values just because it hasn't been developed for this. Well, first of all, you have the hardware that needs to be miniaturized. That's for sure, to suit really very young patient, which is something that Gabi SmartCare has done. But besides that, you also need to really work out your signal. So all these wearable solutions are delivering a specific signal, which is very different on the child from an adult. And so you need to have some specific development in terms of signal processing to make sure that you have reliable values. And to do this, we are working with children's hospitals in Europe, but also in the US. We have 8 parameters, which is enabling us to provide really a large scope in terms of medical assessment. And last but not least, we're currently working on some respiratory medical interpretation algorithms to really deliver the best values to respiratory patients. In terms of go-to-markets, we want to address 3 different, let's say, business line stakeholders. The first one is the researchers, because we have a partnership with Johnson & Johnson since end of last year, who are looking potentially for some kind of product like ours to accelerate drug development and transpose the clinical trials pediatric that are currently happening in hospitals and transpose them in a house. But we also want to deliver the value to hospitals and physicians for ER triage and so on, but also for early diagnosis and surveillance of conditions. And finally, we want to enter into homes to really empower parents to improve home management and prevent complications.
That's great. Thank you. That's 5 minutes.
All right. Okay. My bad. Sorry. Do you have any questions then?
The obvious financial questions would be.
Absolutely. Sorry. So we're currently raising 5 million euros since we have a solution that is currently working, fully functional, and that needs to be medically validated. We have a clear roadmap that has been put together by experts meaning like external companies, but also medtech entrepreneurs that are supporting us on a daily level. And to do this, we need 5 million to cover our next 24 months. We're going to get the 510K for this, turn one of our partners into B2B customers. And also we're going to go through product market fit validation studies with some hospitals. And that includes the Children's National Hospital based in Washington, DC.
Great presentation. Other questions?
Yes. In your opinion, should all babies wear it? And if it's the case, do you plan on having it reimbursed by insurance, or should it be out of pocket?
Right. My first answer is no. It should be used for medical purposes. We currently have identified several indications for use. One of them is clearly inpatients for ER triage, for example. But besides that, we've also identified some other indications like chronic respiratory diseases. And in Europe, you also have a specific category that's called children or newborn at risk. That includes all congenital heart disease or respiratory tract infection and these kind of things, or very severe premature babies. And all these kids in some countries, and that's the case in Belgium, are per default monitored at home with very old solution today. And that's clearly one of the tools that we want to replace. And then is it going to be reimbursed? Sorry, the answer is yes as well. And I know that in the US, for example, you currently have some remote patient monitoring reimbursements within the Medicare system. We already have identified some codes in Europe and in the US for this.
Jonathan, who do you see as a key competition in this marketplace?
We have identified a few. We have identified companies like Vital Sinks, for example, in the US, that is developing a disposable system. So we are slightly different from this. We're focusing a lot on analytic, but besides that, we are a rechargeable solution aiming to make continuous monitoring. But clearly, this is one of the competitors we're seeing. Besides that, we have we have another Taiwanese company that we have identified as well, that has developed a portfolio of remote monitoring solution. Once again, it's probably lacking from analytics, at least currently. And that's one of the area where we want to focus.
So one of the things that everybody, you didn't really mention payers and then people who are managing the risk that they always worry about is their $1 million babies. So how much do you think that this can actually prevent additional costs for those who are paying the bill?
Very good question. So if you look, I think one of the main things is like chronic respiratory diseases. If you take a child that doesn't succeed to keep the disease under control, it's going to cost around $2,000 more per year. And you have like 5 million children that are suffering from this. So if you make the maths, I mean, you have a huge gain by using solutions that can help you to manage chronic conditions. That's one thing. But then besides that, all of these premature babies or at-risk babies as well are currently the monitoring system that I was talking about in Europe, for example, is costing today 4,000 euros for the system. Our system is at 500 euros. So it's already a big gain for hospitals, and you have a huge clinical outcome for the patients as well.
Okay, so I'm looking at the slide that you got interrupted on, the track record slide. So I'm not really sure where you are in the product. That one, no, that one. So I see that you've been in the J Labs Accelerator, whatever.
Yeah.
Your product is fully functional, existing. You've got the device, works on preemies, everything already.
Yeah, absolutely. So the device, you see it here, is already FCC, NCE consumer compliant right now. And so we are now running some pilot trials with some children's hospital here in Europe, and we are getting into negotiation with the Children's National in Washington, D.C. to do the same.
It's exciting.
How big is this market? I saw some numbers going around, but I wasn't exactly clear.
It's pretty serious.
I mean, I know there's a lot of babies,
Not
obviously, but
even
how many?
Insurance or risk-bearing entities here.
Yeah. So if you look at the pharmaceutical companies and CROs, you have about 1 million children that are enrolled every year throughout some business model that we are currently working at with our partners. We are reaching a $1 billion market globally. With hospitals and physicians, though, you have much more children there, and we still need to go through product market fit validation to validate business models that we have identified already, but we have a few and we need to validate them.
It does
That's
seem like
great. That was 5 minutes. Thank you.
Okay, so once again, if you have more questions for John and his team, please pop